My name is Sara Smith. My pronouns are she, her, hers. I'm a professor of history at American River College, and today's date, I believe, is May 25th, yes, 2023. So let's start off by establishing the basics. What's your full name? What are your pronouns? And what's your date of birth?
Uh, my full name is Spencer Parker. That is not the name that I came with, but it's a name that I legally changed to. My pronouns are he, him. Sometimes with my friends, I'll let them use it pronouns for me, which is like kind of a special case, and I know a lot of people don't do that. And then I'm 24. You asked my age, right?
I'm not that good with math, but
Yeah.
Okay. Tell me a little about yourself. What are your interests and hobbies? What do you like to do?
I'm kind of all over the place with stuff that I'm into. Lately, I've been really into puzzles. Like jigsaw puzzles, and I've also started getting into like cars, sort of. Like I've gotten into like electric cars, which I think is nice because it's something that I didn't really get the chance to experience due to growing up as a woman. My dad was a mechanic, but I never really got invited to like check out his work. So I've been kind of getting into cars, and something I've always really enjoyed is art, and that's what I'm going to school for, is getting an art degree.
And what kind of art are you interested in? Do you do art as well, or you study art, or both?
Yeah, I mostly like line art artwork, like just like in a sketchbook or like on like digitally, and that's something that I kind of go on and off about. Like I'll not touch a notepad for like 2 years, and then I draw for 6 months straight. And I like to learn about other people's and other types of artwork, like filmmaking and stuff, and like photography, but not really to do it as much.
Did you say that your major is art?
Yeah, I'm working on getting an Associate of Arts because I was told I need to do that before I work into getting started on what is it called, Master's in Teaching.
Okay, so where did you grow up, and where do you live now?
I grew up in Central Texas, which is very Republican, and now I live in West Sac, which I like better.
How long were you in Central Texas for?
From the minute I was born until I was like 21, I moved to Oregon, and then I moved down here.
So is your family still in Central Texas, or are they here as well?
Yeah, pretty much all of them still live in Texas.
Okay. And what made you leave when you were 21?
Uh, I decided to move in with my cousin who lives in Oregon still, and she was like, "I have a spare bedroom if you want to use it, and you can just pay me like a portion of rent." And I packed my bags and left because I my relationship with my mother and my father was getting worse. A lot of it was due to my gender, and a lot of it was also due to like politics. And I just couldn't stand being around them anymore so much that like in order to like preserve my mental health and my life, basically, I had to leave.
Um, and where in Central Texas did you grow up?
Uh, Bell County, which is like nobody knows exactly where that is, but um, it's kind of near Fort Hood, if you know where that is. I don't know. I feel like that's the biggest landmark that I can think of.
And then you wound up in Sacramento. When did you move to Sacramento?
Um, at the end of 2020, around September, I think, because my house in Oregon burned down from a series of wildfires. I remember they were really bad around that time, so I needed to find somewhere to go, and everyone else was also looking for housing, so I moved way, way down here, and my partner was already living in Roseville, so I was like, I want to be closer to you anyways, so I just looked for housing in Davis, and then I ended up moving to West Sac after that.
Wow, did you lose everything in that fire?
Yeah, pretty much. I packed 2 backpacks full of stuff that wasn't what I needed, because I didn't grab, like, official, like, documents and stuff, like my social security card and that kind of thing. So I ended up having to get all that replaced. I just grabbed like sentimental items. So yeah, I anything that like made me think of home or anything like that, I pretty much lost.
Where in Oregon were you living?
In Medford, which is like the southern border.
That sounds horrific.
Yeah, it was really scary, but it was okay.
You survived.
Yeah, I survived.
Everybody survived that you knew.
Yeah.
So where do you currently attend college? Are you full-time or part-time? And when did you start?
I started this last year in the summer at Cosumnes River College, and I'm a part-time student. Sorry, I was trying to remember what else you asked.
Full-time or part-time, and when did you start? Yeah. So why did you choose CRC?
Honestly, I used to ride the bus for a couple hours to get to Roseville to visit my partner, and I would ride the Cosumnes River College light rail to get back to Davis. And so whenever I just heard them say, "Hey, this light rail ends up at Cosumnes River College," I was like, "Oh, okay, I know how to get there, so I'll just go to that campus."
Wait, where do you live?
Uh,
Sacramento?
I live in West Sac,
West Sac, that's what you said
Yeah.
before. Yeah.
and then I was living in Davis a couple years ago.
Okay. And why did you choose to attend a community college?
It's cheap. I live on SSI, so the fact that they're able to basically pay my tuition for me, and then I also get financial aid on top of that, is like perfect for me. And also they pay for like transport because they give you a bus pass, and I currently don't drive, so basically the only reason was because I can afford it.
Mm-hmm. Had you been going to community college up in Oregon or in Central Texas?
No, I didn't decide to go to college until I was like 23. I thought that I never was going to go to college. I thought that I was never going to even be employed because I applied for SSI when I was like 19. Whenever I realized that my disability was bad enough that I needed it. And so I never really expected to go to college. I barely graduated high school.
So what inspired you to finally go to college?
Two things, I think. One of them is boredom. Because whenever you live on SSI, you basically can't do anything. Like, you can't even really get a part-time job because then you're at risk of losing the SSI because it's contingent on the fact that you are not able to have gainful employment. So if they start thinking you can have gainful employment and you're like, no, I just work 10 hours a week because that's all I can handle, but that's not going to pay my bills, then things get complicated. So yeah, the first thing is boredom because I really couldn't do anything unless I wanted to, like, I don't know, pick up like a hobby. And then the second thing is I've always been interested in teaching children. Like, whenever I thought, yeah, I'm gonna get a career and I'm gonna have like a normal life and like my disability is not that bad, I've always wanted to be a teacher.
And why part-time?
That's also due to my disability. I think if I took on full-time classes, I would just like explode. So yeah, it's easier for me to manage my time whenever I don't have so many obligations because I have to dedicate so much time to just like keeping myself afloat and managing like my symptoms.
So can you tell me about how you identify with regard to your social identities, broadly speaking, so including your disabilities, things like race, ethnicity, sexuality, gender, religion, class, and so on?
Yeah. I think if I were to order these in like importance of my identity, I think like the most important thing to outside people is the fact that I'm a very white person. It's very obvious that I'm a white person with white privilege, but I'm also not a person who usually passes as male. So I kind of get a bump down. I feel like I'm like doing like a privilege Olympics, but I usually get read as female, so that gives me a lot of trouble, or people read me as trans, so that gives me a lot of trouble. So I identify as a binary trans person, and I've been on hormones for like a while now, but I still get kind of read as like a gender non-conforming or non-binary person by a lot of people, and that can cause a lot of like confusion and bigotry, whereas I think if I passed as male more often, that wouldn't happen so bad. And then I also, about like half the time of my life, I use a walker because I identify as physically disabled. Um, and that's something that me and my doctor are still working on diagnosing. We're trying to figure out why I need that kind of support whenever I like walk for long periods. But it's still a big part of my identity, even though I'm not fully like set on what I'm diagnosed with. And then I would also say next comes like my mental health is also. I think that's what I primarily got approved my disability income for, like the SSI, and I have like really really debilitating OCD, and that was pretty much the reason why I tried working and then I couldn't do gainful employment because my OCD was so bad that it was impeding my ability to like work sustainably, I guess, or gainfully. That's right. It impeded my ability to work gainfully, and my employers would just get like mad. And then down from that would be I also identify as a low income person, as in like really really poor. Like I make about $1,100 a month on SSI, which if I didn't live in subsidized housing, I'd probably be homeless with that kind of income here in California.
So can you talk a little bit more about your physical disabilities?
Yeah. I my So the primary symptom that I have that's a problem with my disability is whenever I'm on my feet for long periods or under a lot of stress and also on my feet, I tend to basically faint. And a lot of people think it's tied to anxiety, but not always. Like if I'm in an airport for a really long period of time, I might start to get lightheaded, so I'll bring my walker or I'll use a wheelchair. Um, and my doctor's trying to figure out if that's something called POTS, P-O-T-S, which stands for Postural Orthostatic Tachycardia Syndrome, which basically means whenever I'm standing upright, my blood pressure drops and then my heart rate increases, and that can make someone faint.
How long have you had that condition or these symptoms?
I think it started with puberty, and I think it was exacerbated by my diagnosis of anorexia nervosa, because whenever you're malnourished, you're more susceptible to like losing consciousness and that kind of thing. So it just kind of all snowballed together.
And why do you think it's taken so long to get a diagnosis?
I think part of that is that doctors don't take women seriously. I came out as a man whenever I was like probably like 12 or 13, but I still get read as a woman even whenever I tell my doctors like, hey, I'm male. And so women who look very able-bodied tend to not really get taken seriously whenever they have complaints, especially because a lot of my complaints would be like, hey, this gets a lot worse around my menstrual cycle. And doctors are just like, yeah, that's normal, even if it's not. And like I would do labs and they would come out fine. So doctors would be like, I don't really think there's anything wrong with you. I haven't been able to get diagnostic testing until now. Actually, I have a appointment coming up to do a test to see if I do have POTS. And that's taken a long time, even though I've had doctors go, yeah, you might have that, but it's not severe enough for me to really want to do anything.
So you've had these symptoms for over 10 years and you're getting some diagnostic testing now?
Yeah.
Okay. Do you think the way that you were treated, the fact that they didn't take you seriously, do you think that has to do with being low income at all?
I think so, yeah. All of the doctors I've ever seen have been Medicaid providers, which I don't think they really get paid enough to care a lot about something that seems very minor to them, because they're probably dealing with people who have a lot worse issues, because like people on Medicaid I think generally don't really have a very clean bill of health, because a lot of them don't have insurance for a really long time, or they don't understand how to get it, and so they accumulate all these problems, and so then they are like, hey, I have insurance now, I want to come see a doctor, and the doctor's like, oh god, you have so many things wrong with you. And I feel like whenever you come in and you seem like very like composed and like well off and like you shower daily, they're just kind of like, yeah, you're good, you're fine, I have more important things to worry about.
What about your parents? How did they like try and support you in your sort of finding healthcare?
My mother, whenever I started having these symptoms, was initially very empathetic, and then she started thinking that I was kind of just trying to get out of school. And so, no matter what I really said about it, she would try to push me to go to school, and then I would throw up or faint at school, and they would go, "Hey, you have to go home." And then my father never really was having any of it. He just never really thought it was anything serious, and he was like, you just need to eat more, drink some more water, and you'll be fine. You need to take better care of your body." And this was happening regardless of what I did a lot of the time. So I I wasn't I didn't really feel supported by them. And then also, whenever I was like 16, my father just decided to stop doing his responsibilities with the government to keep our insurance. Because we had Medicaid because we were low income, but my dad just decided, I guess we weren't going to the doctor enough or something, and he just didn't like, he was supposed to like report his earnings or something in order for us to keep getting insurance, and he just never did that, and I was powerless for that. So for a couple of years I had no insurance, and then I had to apply for insurance on my own whenever I became an adult, and that was a very long and arduous process because since I did in Texas, it was really weird. Like, I didn't have any income, and I also relied on my parents. So they're like, "You should be on your parents' insurance," and I was like, "Well, they don't have any." And it was, I don't think I had insurance until I got on supplemental security income because those are like packaged together. You're required to get Medicaid whenever you get federally funded disability income.
So how did it make you feel? How does it make you feel that it's you've had these symptoms that are fairly debilitating for so long, and people around you, including healthcare professionals, and even your parents weren't taking these symptoms as seriously as perhaps they should have?
I think I think along with most things in my life, it just made me feel like an afterthought or like not really seen. And I think that was compounded by my gender identity. Like, people didn't want to see me as I was in regards to my gender, and they also didn't want to see me as I was in regards to my disability. So it's like I started with the whole like transgender thing, and then my health started getting worse, and it's like I was demanding more attention and to be more heard, and like people did not want to deal with that. Like, they wanted me to be like a normal person with a normal amount of needs, and for me to not have to be accommodated. And so it just made me feel like kind of like a burden, I guess.
So I don't know that did you mention your sexual orientation?
Oh, no. I don't really think about it very often because I just identify as queer in regards to my sexual orientation. So it's something that I thought about a lot, like, through my adolescence. Like, at first I thought I was a lesbian before I realized I was a trans man. Then whenever I realized I was a trans man, I thought, maybe I just like dudes. And I was like, maybe I just like women. And then I was like, maybe I only like other trans people, which isn't really, like, an identity that a lot of people, like, talk about. But I think it is something that happens. And I just kind of got, like, tired of it at one point because I was just like, well, I know I'm male. And I know I like people whenever I have a connection with them. So I don't really care about what their gender is, to be frank. And I didn't feel like bisexual or pansexual really fit the mold for me because gender isn't really something that I'm contingent on, gender or lack thereof. So I felt like those labels didn't really apply. So I just have identified as queer in regards to my sexuality since I was like 19.
Where did you hear about the word queer?
Oh gosh, where did I hear about the word queer? I think I first heard it as a slur. Like, I had people call me queer whenever I started exploring my sexuality, because like I was not a very socially aware child. So whenever I was like 11 or 12, I started telling people that I liked girls. And like that did not go over well with my peers. So I started getting called like queer, like as an insult. And then I learned later, I think online on like Tumblr, that people were using it as like a power word, I guess. It would be like, yeah, we're all very queer. Like, and I especially learned that it has connotations with like being weird or like out of the ordinary, and I really liked that because I've always kind of felt like misplaced. So I think I just kind of gravitated towards the term queer because of the like origins of it.
Was the town that you grew up in quite small? Or how big was it?
I would say it was like medium sized. I considered it a small town, but I've seen people in like super small towns. I would probably say there's less than 50,000 people and more than 10,000 people.
Okay, you said you identify as a binary trans man, right?
Yes.
Can you elaborate on what this means to you? And also sort of, your coming out experience, coming out at 12 or 13, realizing who you were.
Yeah. So I identify as a binary trans person, primarily because I explored the idea that I might be non-binary, but I realized that I wasn't comfortable with being considered as anything other than male. But I did like the idea of being gender non-conforming, and I thought that was something that I wasn't allowed to do as a trans male person. Like, I thought that I had to be either non-binary or completely like by the book manly. And so for a long time I identified as non-binary, and I think I came out whenever I was like 11 or 12, and I started telling people that I was a lesbian. And that was because I felt like a very masculine person, and not necessarily because I liked only women. Like, I always kind of knew I liked men and women. But I thought, well, I can't like both and also be like a very masculine person. Like, I felt like I had to be a feminine person in order to like both. Because I didn't think I could attract men by being masculine. And then whenever I realized that I could transition to another gender, I came out whenever I was about 13 to my friends and be like, hey, I think I might be trans, and I'd like you to start treating me as a male. And then I think whenever I was 14, I came out to my family and I said, I need you to start treating me as male. For the past year, I've had my friends call me male, and like, I really like that, and it's like, it hurts my heart for you guys to not address me appropriately, because I really need that. And so I came out as a lesbian, and then I came out as a trans man because I didn't really understand that non-binary was an option. And then when I found out about non-binary people, I was like, oh, okay, that probably fits me because of the way that I express myself. Like, I still like dressing in women's clothes, and I like feminine hobbies. And then as I got older, I realized, well, I like those things, but whenever people treat me as a woman or they are ambiguous about my gender, I get really, really uncomfortable. So I think whenever I was like 17 was when I realized I'm not non-binary. I'm definitely a binary person.
Wait, how old were you again? Say that again.
I am 24.
Yeah, no, but how old were you when you realized you're a binary trans man?
I realized I was binary, I think, whenever I was 17 or 18.
Oh, okay.
Yeah.
So when you told your friends, how did they react? Were they supportive?
Yeah. I think I always kind of gravitated towards people in my life that were either neurodivergent or LGBT, and those, I think, often intersect. So I never really had any issues with telling my friends, like, hey, I think I like girls, and then I was like, hey, I think I might be transgender. Like, I never really had issues with that with my friends, even though I grew up in Texas, because I think even without knowing it, we kind of congregate. But I did have issues with other students who weren't my friends. But with my friends, I never really felt ostracized or anything. I never had people, like, leave me because of coming out as trans.
Did they adapt to using the right pronouns pretty well?
Yeah, I think in middle school, my friends really adapted to that really well. And by the time I was a freshman in high school, I was like sending teachers emails and being like, hey, you need to address me as male. I'm going to tell all the other students that I'm male. I need to be accommodated. So I just it was basically like after that point, I would introduce people and myself to people and be like, "Hello, I'm Spencer. I know I look like a woman, but I'm not. It's nice to meet you." Um,
It's a pretty brave thing to do at 15.
yeah. I think it was partly bravery, and I think it was also partly like that just lack of social awareness that I have is that like I didn't realize that like that's something that could get me in trouble because I hadn't really experienced any moments where it got me into trouble. Like I have experienced people like using like words like gay or like gay related slurs as like insults, especially with like in 2012 like gaming people would call each other gay like an insult like constantly, and like I understood that, but it never really applied to being transgender. So I didn't understand that that was something that could be a problem until it started being a problem, and I was already out to everyone. So I was like, well, I can't go back now.
So how did it make you feel when you were 13 and you came out to your friends? And then they accepted you and they were supportive of you. How did that feel for you in that year? Do you remember?
Um, I think I just felt relieved. Like, I think people see it as like a magical thing a lot of the time whenever they come out and finally get recognized as the proper gender. But for me, with my friends, I didn't expect anyone to react badly. Because I already had friends who were coming out and being like, I think I like the same sex and like stuff like that. So I was just like, oh, thank God. I got it off my chest and you guys are being so nice about it. I can just worry about other things like studying.
How did you know that being trans was an option?
Like most things I learned about being queer, I learned it on the internet. I think I saw another trans man's video of him getting top surgery, and I just immediately was like, whoa, that's an option. That's crazy. So, yeah, I think it was just online.
Online. And then when you came out to your family, if you feel comfortable, how did they respond?
I think most people in my family were just kind of like, well, this is a phase that you're going through. And my mom initially was like, yeah, that's fine, and I support you. And my mom is kind of like that with everything, and then she'll be kind of like underhanded about stuff. Like, she would be like, yeah, that's fine, and I support you, and then would not address me correctly in public, or like would introduce me with the incorrect name to like strangers, or like wouldn't explain to family members that I was now transgender, even if I would ask her to. And with my dad, he just completely shut it down. He was just like, I'm not doing that. I'm not calling you a new name. I'm not calling you new pronouns. You're always going to be my little girl. That's the end of that. I'm not going to be mad at you. I'm not going to like get pissed. But I'm not going to adhere to any demands that you make about that. And my siblings were just like, yeah, sure, whatever. My siblings were just like, I'll pay you whatever you want. It's going to be hard because I've known you for the last all your life as another person. But like, yeah, I can adjust to that, no problem. And ironically, I only talk to one of my siblings now. I don't talk to my parents because of the way that they just wouldn't treat me with that kind of respect.
How many siblings do you have?
I have 1, 2, 3, 4 siblings.
It's a decent number.
Huh?
It's a decent number of
Yeah.
siblings.
I only talk to one of my siblings now. I probably would talk to 2 of my siblings, but one of them unfortunately passed away.
Oh,
and then the other 2 are just not very nice to me.
Oh. Where are you in the lineup in terms of your age?
I'm the youngest in my family.
Okay. Can you talk a little bit more about, or talk about how your parents' reaction to you coming out made you feel?
You know, I have a hard time identifying and remembering a lot of the feelings that I had about coming out and about life with my parents whenever I realized that I was transgender, because I think I tried to dissociate myself away from it a lot of the time because it was so hard. I think I remember feeling, I think I remember feeling very like isolated, very like ashamed whenever I came out to my parents. And like, it was sort of this underlying shame and not this like overt, like terrible feeling, because my dad just wouldn't address it and wouldn't talk about it, so I could kind of ignore it. But with my mom, she would say, yes, I support you, and then wouldn't follow through, or and stuff like that. So I remember one time I was with my mother and we were hanging out and she'd been drinking a little bit. And I don't know what prompted me to ask this, but I was like, whenever we go out in public, are you like ashamed of me? Are you embarrassed by me? And she was like, yeah, pretty much. And having her admit that kind of made me feel this like, wow, I feel like I'm putting this big thing on you to like have to accommodate, even though to me it feels like a really simple thing for people to do. And to know that like she is so she's having such a hard time with it that she's embarrassed by me, even though it's a decision that doesn't affect her. It just made me feel really bad. Like the best word I can describe it with is just feeling bad and feeling like wrong inside.
So, were you very emotionally close to your parents?
I think I was really close with my mother. I don't think I was very close with my dad, even though I tried to be a lot, especially because he was a very masculine person and I wanted to learn from him, I guess, on like how to be a more masculine person and like how to adhere to like gender norms for men. But I think he picked up on that and he didn't want any part of it, so we didn't really have a relationship. But I think with my mom, I think she was convincing herself that she was trying a lot harder than she actually was because she couldn't fully commit to, like, I guess, respecting my gender, which I feel like maybe sounds like a big ask or like I'm expecting too much of her. But because of our relationship and because of a lot of the things we went through together, I feel like I can say that with confidence, if that makes sense. Like, even though other people who don't have context aren't going to understand what I say whenever I say, like, she wasn't trying hard enough, I know that still.
And why do you think they reacted the way they did?
I think my dad reacted the way that he did because he was raised Lutheran, which I think is like a Christian denomination that's like not super popular. And my father seems like he was a very traumatized person due to his religion. And I do understand that many, many religious people can be entirely accepting and they can have like totally like kind lives when it comes to LGBT people. But for my father, that just wasn't the case. And I think for my mother, who was raised as a Jehovah's Witness and then decided that she hated that and she wanted to go against it, I think it was hard for her because she still had a lot of internal biases, even though she was so adamant about being like, I'm going to be better than my parents and I'm not going to be corrupted by the bad parts of their religion and I'm going to not follow that religion and that kind of thing. So I think it primarily was religion that affected the way that my parents acted about my gender. And then also I think some expectation of like me just being a normal child. Like I think everyone wants their kids to be as normal as possible because they don't want them to get bullied and stuff. And so whenever your kids come out and they're not very normal, it's like a new stressor and you just want them to conform so that they're the safest they can be.
And did you find support from other people in your family? I mean, you talked a little bit about your siblings, but did you have other family members that you were up to that you found support from, or how did they react?
Most of my family, it either wasn't something that came up or it was just like, yeah, whatever, and they didn't really try. But I did find a lot of comfort in my older brother, who I am very, very close with still. He has always worked very hard to call me the correct name, the correct pronouns. And then my aunt also worked really, really hard to address me correctly. Sorry if I sound like I'm gonna cry. She passed away recently, so it's very emotional for me. But like even like to the end, she was having a lot of cognitive impairment issues, but she still was trying really hard to be like, I'm trying to remember the new name that you go by. I'm trying to make sure that I do that correctly. And like the fact that she did that even while she was like deteriorating in health like really rapidly, that just meant the world to me. And so I think even though it was only those two people that were really super supportive, I think the fact that they were so supportive is part of the reason that I was able to thrive as a person.
Did your aunt live in Central Texas?
Yeah, my aunt and my brother both live in Central Texas.
Was this your mom's sister or your father's sister?
My mother's sister.
Oh, anything else you'd like to say about that? Anything you'd like to elaborate on?
Yeah, what was it? It was about family being supportive. Oh, and then also there's my cousin, who is the person who I moved in with her, and I moved to Oregon with her, and she was like, "Yeah, I understand that your family is really weird about you being transgender, and healthcare is pretty good for trans people here in Oregon. So if you want to come move up here and just pay a portion of rent to me, that's totally cool with me, and I would love to be able to support you in that way. And like, you're totally going to be respected as your gender while you live here." So I thought that was really awesome. We ended up having issues about other things, so we don't really talk anymore. But she was always really supportive with my gender, even though she was raised by my mom's sister, because we're cousins. And like, she's probably even more bigoted than my mother is, but somehow my cousin ended up being a very progressive person and was very kind to me regarding that.
So did or do your parents align politically with would you classify them as conservative generally, or?
I would say that my parents are generally conservative. I would say that they disagree on a lot of that stuff, like between themselves. They disagree on a lot of like politics stuff. But I think they're both very conservative people. I think my mom likes to think that she's a progressive person, but in recent years, she's become susceptible to a lot of propaganda from like very far right people. And then my dad has always kind of just not cared enough he just has always had these kind of bigoted ideas, and he doesn't care enough to really learn like where they might be wrong. But my mom had a period of time where she was like, yeah, I want to unlearn this stuff. And then I think maybe it was too hard for her. And so she just kind of went back on it. Or maybe too scary.
You don't have a relationship with them now?
No, I don't have a relationship with my parents.
And do they know why?
I think my parents think they don't understand why I'm not talking to them, but I think if they analyze the situation a little bit, they would be able to understand why I don't talk to them, if that makes sense. Like, I think my mother especially sees herself as like a victim of like, I just decided to up and stop talking to her. But with my dad, we just kind of ended up stop texting. Like, it was just slowly over the course of time, like we just ran out of things to talk about. And he would still answer the phone and like call me the wrong thing. So I just was like, hey, I really need you to call me the right thing. And he just kept on not doing it, so I stopped talking to him. And then with my mother, whenever we stopped talking, she texted me, and I took a little bit too long to text her back. And so she was like, you know what, I'll just lose your number. And I think that was the culmination of like a lot of little things of me like getting into arguments with her on the phone, or like being like, hey, this political thing that you posted on Facebook isn't very nice, or like just trying to like kind of get her to rethink the way that she was acting. And she just didn't like it. She didn't like the idea that I was going against her, and also she didn't like the idea that she might be wrong about things. Like, whenever I'd be like, hey, I don't think this is very kind, she was like, you can't accuse me of not being a kind person. And so I think that all just accumulated, and she was like, you know what, I just won't text you anymore. And I just said, okay. I just was so tired at that point that I was like, I'm trying to have a relationship with you, and I'm trying to like show you that like you're not being a very kind person a lot of the time when it comes to trans people, whenever it comes to people of different races. And it wasn't really having any of it. And whenever she was like, okay, I won't talk to you anymore, I was just like, I'm not gonna fight. I know she's trying to get me to fight. I'm not gonna.
So have you been able to pursue a like legal name change?
Yeah, I legally changed my name like a year and a half ago. And that was really, really easy. I did basically all of it online, and then I went and picked up my papers. I didn't even have to show up in court or anything.
And how was the cost covered? Or how much did it cost and how was it covered?
I'm not sure how much it costs because it was completely covered here in the state of California because I get supplemental security income. I'm also on the Medicaid program. I also get food stamps. So, like, because I was eligible for those programs, I was able to have fees waived so I could just totally get my name changed without any cost to me.
So when you're filling out the form, does it ask you these questions? Like, are you, what your income level is, or if you're on SSI?
Yeah,
Yeah.
it does like towards the end, at least on the online version that I did, towards the end it was like, hey, would you like to apply to get your fee waived if you're in any of these programs? And I said, I'm in these programs. And it was basically like, yeah, you're good. Go ahead.
How long did it take for the process to go through?
I think, well, I didn't get notified whenever it was complete. So I was told this will take about 3 months, and then you'll get a email or a phone call, and it'll be like, "Hey, your documents are ready to pick up, or you have to come to court." And so I set an alarm to check it like every month, and I think after about a month, it was all cleared, and I could just go pick up my papers. But I didn't realize I could go pick up my papers because no one told me. So I think I waited another like month and a half because I was forgetting to check online to be like, is my paper documents ready? Because I was like, well, I didn't get an email, so I won't even check on the website. No, I decided, you know what, I should probably check on the website because no one's contacted me at all. And so I checked, and it was like, yeah, all your stuff's done. You can just pick it up. Like, you don't even have to go to court. And I was like, cool, thanks. So I went and I got my certified copy, and I started doing all my changes.
So why not? How come you didn't pursue a legal name change sooner?
Um, I was under the impression that I had to do my name change in the county that I was born. And I was under that impression for like most of my life, I think. But then whenever I moved to Oregon, I think I realized that I didn't have to do that. And I was about to pursue it with the Oregon legal system. And then the pandemic happened, and I had other priorities. And then I moved down to California, and I found out I could just do it all online. So I just did it online. Since everything, like, it was like after everything shut down that things were starting to open back up online. So,
So did you find the process pretty simple, changing your name? Or was it an easy form to fill out?
yeah, I think for me, the process was very, very simple and easy to get my name changed. But that's because I knew where to look. It took me a lot of like hunting and like trying to figure things out. At first, I was like, okay, I have to print all of these documents and bring them in, and like I knew that you could e-file court documents, but I didn't understand how to do it for a name change. And so I had to do a lot of searching and digging in order to reach that conclusion. And I know there are people still who think they have to do it the old-fashioned way, or like they are doing it online, but it's not as easy because the way the paperwork is set up is really confusing. Like the document that I was able to fill out, it explained everything because like they use a lot of weird fancy words when you do a name change, and like I could just click on like a little info bracket and it would be like, hey, here's what you need to put here and here's what it means. And I think if I didn't have that kind of accessibility, then it would have been a lot harder for me to change my name. And I try to encourage other people to follow the same route that I did, but it's hard to teach people how to access that information.
Do you think it would be helpful if that kind of support was provided at CRC or any of the other community colleges in Los Rios to students needing to pursue a legal name change?
Oh, absolutely, yes. I think any kind of like workshop or anything like that that helps people to learn how to know their like legal rights as a trans person, whether that's regarding their name change or regarding anything else regarding medical care. I think resources like that are really, really important because that helps people stay alive. To be honest, like I think if I wasn't able to legally change my name and my gender marker, I would be in the psych hospital a lot more times than I have because, as you might know, the suicide rate for transgender people is really, really high, both attempts and successes. So I think anything that gives people resources to live their life as they're meant to are like, we need more of those literally everywhere, whether that's college campuses or like private programs or public schools, stuff like that, everything.
So, Can you talk some, if you're able to, about how your disabilities are shaped by being queer and trans, vice versa? How do you see them sort of relating to each other, different parts of yourself?
Yeah, I think I am a very I identify as a very intersectional person, I think is the word, of like everything crosses paths whenever it comes to the identities that I have. Um, I think that my disability and the way that I'm treated due to my disability is exacerbated by the fact that I'm a queer person. Um, and I think also my mental health is exacerbated by the fact that I'm a queer person. I think everything comes. I'm trying to find a way to word this. I'm sorry.
Take your time.
Um, I think the main way that being disabled and queer and mentally ill and neurodivergent, I think the primary way that all of those things intersect is the way that other people treat me. Because if someone is treating me weird because I am a very obviously trans person to them, um, they're going to treat me doubly with bigotry and like with bias if I have my walker with me also, or if I seem like I'm acting weird or off because I'm a neurodivergent person and because I look like a trans person, like a visibly trans person. I think both of those things compounded are going to make people be like, you're really weird. And like, I think everything is just kind of like stacks on top of each other in terms of how people treat me. And that's the main way that those things intersect.
Has it influenced, do you think, how medical professionals treat you? So if they see you as queer, as visibly trans, do you think they have that's impacted how they treat you when you seek their medical help?
I definitely have had doctors treat me differently because of my gender identity, mostly in mental health spaces. Um, with my primary care provider, and this is just in California because I can't really remember much about medical care that I got as a teenager. But here in California, my primary care provider is wonderful, and she's very like, hey, I understand that you're trans, and that's going to affect how everything else gets treated. I know that other doctors are going to treat you weird, so I'm going to make sure I refer you to doctors that I trust whenever you need like any kind of specialized care. So I've been very privileged in that regard. But in regards to my mental health, like particularly the last time I went to get inpatient psychiatric care for suicidal thoughts, I remember I asked for my documents back that had like the notes in them, and I saw on there that the attending mental health physician or whenever he assessed me, he made a note that I was making no efforts to appear as male somehow. But I definitely was. I was wearing all men's clothes. I've always had my hair cut really short. I think he just didn't understand that. Like, he didn't ask me anything about that kind of thing. He just made a note that, like, I was not trying to appear as male, and he also didn't address me correctly in any of the notes that he took. And the other staff members, it was like half and half if they addressed me correctly. Like, there was a note like, hey, patient prefers he, him, his pronouns. And then everything else is just like a mixed bag. But with like medical professionals that aren't mental health professionals, I tend to not have that issue.
So I asked you before to elaborate on your physical disabilities, and I realized I didn't ask you to elaborate on your how you are neurodivergent. You mentioned being OCD. Mm-hmm. Do you want to talk a little bit more about that?
Yeah. I identify as a neurodivergent person primarily because of my OCD that's very debilitating, and also I have issues with dissociation. And some people don't consider that as neurodiversity. Some people consider only ADHD and autism as neurodiversity. But I think OCD and autism have a lot of overlap. And I also think that I'm probably undiagnosed with autism or ADHD, and I just don't know how to seek a diagnosis for that kind of thing. And I can't remember where I was going with that. I'm so sorry.
No, that's okay. There's a place called Alta Regional. They provide free diagnoses of autism for adults.
That's cool.
I can't speak to the quality of their care.
That's a good.
I just have heard of
it. Yeah.
So you mentioned before that trans people have high suicide rates, and they higher rates of suicidal thoughts, and also higher rates of actually committing and successfully committing suicide. And then you mentioned that you sought inpatient care. So this is a question I'm asking that you should feel free not to answer.
Yeah.
But is there anything else you want to say about that, particularly as it relates to your sort of identity as trans and queer, and how your identities intersect with each other? Is there something that you feel like is important to mention?
Yeah. I think the first thing I want to mention is I think I probably don't want information about my mental health diagnoses in this project, because I started talking about it and then I realized, actually maybe I don't want that on camera.
Okay.
So maybe the stuff about dissociation and maybe we take that out.
Okay, we can edit that out.
Yeah. But I am okay with saying, in regards to suicidality and my experience with that, I want to stress that even though trans people have a higher rate of suicidal thoughts and suicidal actions, it is not always tied to us being trans. A lot of it's tied to other factors, but it's compounded by the fact that being a transgender person and being out about that, or needing to come out about that, it warrants a lot of disrespect from other people. And also, the answer to a trans person who's experiencing suicidal thoughts is not to try to make them stop being trans, because you can't make someone stop being trans. You're just gonna make them miserable. I don't know exactly where I heard about this, but I think generally it's considered that people who are able to fully transition have a lot better mental health than people who try to get themselves to convert back to not being transgender. And I wish it were more widely accepted that the solution to helping trans people not have such terrible mental health is not addressing the being trans thing as a bad thing. It's addressing it as okay, this is normal, and this is something that's just something we have to work around. It's not something that we have to heal or fix.
I think that's a really important point to make. So tell me about your strengths as somebody who is out as disabled, somebody who is queer and trans. Do you find that you feel empowered in your identities?
I think I feel a lot of fear in regards to being a trans person, in regards to being a disabled person, and in regards to being a mentally ill person, because of the stigma around all of those things. But I think more than that fear, I feel very empowered to help other people that are like me, who feel more fear than I do. For example, I've talked about how I have an intersectional identity, but there are also other people who have an intersectional identity, for example, where they are maybe a Black woman who is disabled and also is queer. And those kinds of identities intersecting is going to cause someone a lot more fear for a lot of different reasons, especially because they're less privileged than I am. And if I'm able to use myself as someone who can be hey, I'm here to support you and help you, I think that way overcomes all of the fear that I have about people are going to be weird around me, or people are going to think that I'm bad, or people are going to disrespect me in public. I have a lot less of that fear, because I understand that I have certain advantages over other people that are queer, and I have to recognize that, and I have to use that power to help other people that are queer who are in worse situations than I am.
So you mentioned that your family is low income and that you're currently low income. Can you elaborate some on this? Did your family struggle a lot economically growing up?
Yes, I have always been a poor person. I've never even really considered myself like middle class. Um, my family, so my mom, up until I was about 9, worked from home. She worked on like phone call line type of thing, and that did not pay very well. She did not get a lot of hours. And my dad has always been kind of like self-employed, um, and that also does not get a lot of money or a lot of hours whenever you don't have like a higher up, like a boss that's like, hey, here's your hours and here's your pay. Um, so we always struggled with money. And then whenever I was like 9, my mother became disabled. She was not always disabled, but my mother became disabled, and then she started getting supplemental security income, which is how I found out about the program. Um, and that greatly reduced like the money that we were getting. And it was also around the time of the recession, so that made things worse.
So what did this mean growing up in terms of like accessing basic necessities?
A lot of basic needs that I needed to get met weren't met. Like adequate shelter was a problem. I had a roof over my head, but it was not well insulated. For most of my life, there was not a lock on our front door. Um, it was just broken, and we couldn't fix it. Um, there was issues with like bug infestations. I think I grew up with cockroaches my entire life. I don't think there was ever a time in my life where there weren't cockroaches in my house. Um, and like shelter was probably the main issue, and then the second biggest issue was food. Um, and I think that was compounded by like my mom would get really into diets, and she would get into diets that were expensive and required a lot of resources, but we relied mostly on food stamps to get food. And then whenever she would get cash to go to the grocery store, she would spend it on alcohol a lot of the time, which I could not have as a child. Not very calorie dense anyways. So I think shelter was the main issue, and then food was the second issue, and then just little things that kind of added up were the third problem. Like, I had clothes, but a lot of the times they wouldn't fit me, or they would be hand-me-downs that, like, I wasn't able to express myself like other kids were, or, like, my clothes would be very stained or tattered. I feel like I'm saying a sob story, but this is just the truth of the matter. Whenever you're really poor, this is just how your life is. And a lot of my like resources that were met weren't met because my parents had the money to do it, but they were rather met because there was charity that was able to help me, like things at school. Like I got free lunch at school, for example, so I'd eat really good at school. I'd be able to get free breakfast and lunch. And like school would have like programs for like, hey, for our low income students, we can get like gifts. Like if I wasn't able to, sorry. Like if I wasn't really able to get Christmas gifts, at least I could like go pick something under the tree at school, you know, before they let out for the break. Or I remember I was in a certain program, and I can't remember what it was called, but I was able to get like, one time I got like a backpack and it was full of like toiletries, and it was around like puberty time. So like taking care of yourself started becoming way more important. So I was able to get like toothpaste, toothbrushes, hairbrushes, face stuff to clean my face because like acne starts. And like it was just like, it was like magical for me. They were like, they just give me a backpack full of stuff that I needed. And I was like, oh my God, I have things that I can use like to like make myself feel good and to like take care of my body. And like I feel like that shouldn't be a magical moment for children. Like that should not be a magical moment for children. That should be something that they already have.
So did you go without food sometimes? Were you ever hungry and you didn't have enough to eat?
Yeah, I went without food pretty often. And a lot of that was due to, like, I would have to adhere to diets that my mother would do for herself. And my mother is a very overweight person, which is, like, not a moral judgment on her or anything like that, but she viewed it as a very bad thing. So she would do a lot of diets. And so I would have to adhere to those diets because that's all the food that was in the house. So if she was eating 7 carrots for dinner, I would be also eating like 7 carrots for dinner. Um, so like I was malnourished a lot of the time because of that, and I also was malnourished a lot of the time because of my OCD. Like even whenever we did have food in the house that I could eat, like say we got like an extra payment from food stamps because like they adjusted for like our income or something and they gave us some extra money and I was able to like pick out a few extra things. I still would have issues with like thinking my food was contaminated because of my OCD, and that kind of thing. So I went without food both because of class reasons and because of mental health reasons.
So, did you go to a school where people were also low income? Were your friends low income, or were you sort of, was it more mixed in terms of class?
I think most of my friends were low income, but I don't think most of the students were low income. I think most of the students in my school were like working class, like middle upper class, upper middle class or middle class, like that kind of thing. Um, but I think the people that I tended to hang around with were low income.
Why do you think that is?
Um, I think it's just easier for kids to relate to each other whenever they have the same struggles, even if they don't realize that that's what they're doing, is that they're gravitating towards each other because they have the same struggles. Because I would like talk to other students and they would be like, yeah, I'm doing all these extracurricular activities and my mom drives me around everywhere. She has a sports car and she has like 7 kids and she's able to take care of them all really good. And I bring my lunch home from like to school from home, and like those kinds of things all added up in my brain to go, okay, I'm not going to get along with this kid. Like little things like knowing that a student brought their food home, knowing that another student brought their food from home rather than getting free lunch at the line at school was something that like even as like a 7-year-old would tip me off and be like, oh, okay, you don't have the same kind of problems that I do, so we're not going to be able to get along really. Like even if I didn't realize that I was like doing that like kind of nitpicking.
Did it, trying to think how to phrase the question. Did you ever feel like you looked at people who had more than you, like obviously in terms of how they dressed or the cars that they drove or that they brought, food home from home to school? Was that always very noticeable to you growing up?
Growing up, the class divide between me and other students was very, very noticeable. From like, even from like kindergarten, like I understood that there were students that were like had better lives than me basically. Because like I think it started with like I would see students who had like resources and privileges that I didn't, and then I would go home and I would ask my parents like, hey, can I get this thing that these other students have, or like can we start like doing this activity, or like can we go to like this amusement park or something? And my parents would be like, we don't have the money. Like my parents were always very frank about that. Like we can't afford to do that. That means that you're not able to do things that other students can do. But here's things that we can do. So I think that was always very obvious to me because like I think kids notice a lot more than people think they do.
Did Were you ever angry at your parents when you asked them for things and you couldn't get things?
I think as a very young child, I would get angry at my parents because I couldn't get the things that other children could because of our money situation. But I think when I started hitting puberty, I stopped being so mad at my parents and I just started being sad because I realized that like affects my whole family and we all just can't do things that other people get to do for like fun, for example. And like I stopped being mad at my parents and I just started being sad about my situation because I felt like I don't deserve this. Neither do my parents. Like my parents both work very, very hard. Like my dad is working constantly and like I just started feeling sad rather than angry because I knew that they were doing everything that they could.
Do you think your class status impacted your like how you were as a student in the classroom? Your ability to do well in the class? Do you think it had an impact?
I think for me, my class status didn't affect my behavior in the classroom very much, but I think for other people, their class status affects how they were in the classroom. I guess for me, growing up poor meant that I tried to prove myself a lot more because I didn't want teachers to think lesser of me. But like other people who were growing up poor might have like a learning disability that's undiagnosed, for example, and they struggle a lot because they aren't able to get diagnosed because they don't have the healthcare, for example. So like I think for other people it affected them a lot more in a lot of different ways, but for me it just made me like feel like I have to impress my teachers more because I don't want them to just see a poor kid and pity me.
So you said that you're on SSI and you make about $1,100 a month.
Mhm.
How do you survive on $1,100 a month in Sacramento?
Yeah. So so I think I need to give a little background context about my income and about SSI. In Texas, whenever I was getting SSI, I got a little under $800 a month. The only way that I was able to survive on that amount of income was because my mother owned the house that I lived in, and she basically was like, "Hey, I bought this house next door to my house," and she bought it for like a very small lump sum amount of money because it was it was like a shack basically. And she was like, "Hey, I bought this little house. I'm going to put you and your sister in it, and you guys can stay there. And all you have to do is pay rent for the lot that it's on because the house is fully owned." So I just paid like $200 in lot rent, and then I was able to spend money on other things, and that was the way that I survived. And then whenever I moved to Oregon, I did not pay my fair share of rent. I just paid what I could afford. And it was not very legal because I was basically subletting. And then whenever I moved to Davis, I was able to sign a lease contract with I was living with four other college students. I wasn't in college, but I was just on SSI, and I think it was like $500 or $600 for my rent. So in order to pay for all the things that I needed, I racked up a lot of credit card debt. I think I opened up like 2 or 3 new credit cards in the course of living in Davis. And then whenever I moved to West Sacramento, it was because I was approved for a subsidized housing program, which was specifically for people who have experienced homelessness and for people who are at risk of homelessness. And because I was spending so much money on rent, I was like, I'm not going to be able to keep doing this. Like, I'm gonna eventually not going to be able to afford rent, and I'm going to get evicted. And so whenever I signed up for the program, I explained that, and they were like, "Okay, we can move you in expedited into this subsidized housing unit, which is based on my income. So I pay a little less than a third of my income for rent, and then I'm able to spend the rest of my money on other things that I need." So I've always kind of been like in like a kind of like situation of like living with other people or living in not entirely legal means or living with like help from others.
You don't have a car.
No, I don't have a car.
And so can you cover your other expenses, like your bills and your food and stuff? Clothes, if you buy clothes?
I'm mostly able to cover my expenses mainly because I'm in school now. Because I get financial aid. So once I'm done with undergraduate school, I'm not going to get the same kind of financial aid. So that's probably going to start to be a problem. But for now, I'm able to mostly cover my costs. But it's always like cutting it close, and it's always like at the end of the month because I get paid at the beginning of the month every month. At the end of the month, it's like I'm pinching pennies, and I'm like starting to use my credit card more, and I'm racking up more debt, and like I'll start paying off my cards, and I'll be like, cool, I'm taking care of my debt, and then something comes up, like something minor, and I have to spend like $200 on my credit card that I just don't have that other people would probably have.
So are you living in part on student loans?
No, I don't have any loans,
Okay.
or I have a personal loan, and I have some credit cards, but I don't have any student loans so far.
Okay. And how come you chose not to get student loans?
I think part of it is that I am still doing undergraduate stuff, so I don't really need student loans.
Mm-hmm.
And also part of it is whenever it comes to qualifying for loans and stuff, I think it's really hard for me because I have trouble with my credit. I don't really know how student loans work, honestly, so I don't know if it's based on your credit, but whenever I try to get loans for like other things, it's really difficult. So I think part of it is just like, it's not really accessible to me.
Do you think it's hard to navigate your finances? Like sort of understand your finances and stuff coming from a low income background?
Yeah, I think budgeting is really hard. I think understanding where money is going and how much money things are is really hard. Like, I have like a spreadsheet that like explains my budget to me, but I always seem to mess it up somehow. And like, I've tried attending like courses that are like, here's how to explain how to like take care of your budget and stuff and your finances, and like, I don't know if I said courses. I mean like workshops where people will be like, here's how you can like help get your finances better. But I don't know if it's just because I'm so poor or if it's because I'm doing something wrong. It seems like there's always just like something comes up and then I have to spend like a bunch of money that I don't have, and then I'm in debt again, or like I've overdrafted my bank account. I think another big problem is like with my bank, I will like withdraw money or I'll spend money and it'll say, here's the amount of money that you have. And it'll be a lot higher or a lot lower than I expect. And then like my the amount of money I have will go down and I'll go, okay, I only have like $50. And then it'll go up and I'll be like, oh, apparently I have like $200. Then it goes down again because apparently that was to do with some kind of charge that I didn't understand was like on hold. So I think money is just really confusing for someone who has a fixed income, who has a low income background.
Yeah, I can understand not getting student loans. You might want to talk to the TRIO people and ask them about it.
Okay.
Especially if you're in credit card debt, because you're paying a lot in interest for your credit cards.
Yeah, and I don't know if, because like I feel like there's a lot of things you're not allowed to use student loans for, and it's really confusing to understand what I'm allowed to do with student loans. So
you can use them for a lot of things.
Yeah, because
I got student loans. You can use them for a lot of things.
Because I feel like student loans would be really helpful for me, but I don't know.
You just get the money and then you live off of it.
Huh?
You get the money and then you live on it. So you spend that money on what you want to spend the money on. They don't regulate. It's not like, WIC or something where you can only buy certain things. It's once that money's in your pocket or in the bank or whatever, you spend it.
I'm under the impression that like you have to spend it on certain things, and like, yeah, because I know with financial aid there's a lot of leeway, but with student loans I thought it was just like really, really restrictive.
Nope.
Well, that's cool.
So I made my way through college on financial aid and student loans.
Mm-hmm.
But anyway, I paid credit card. I'm talking about. I paid credit card debt off with student loans, so that's what made me think about it. And
I would love to do that. That would be great for me.
I mean, student loans aren't great, but the interest rate is lower than your credit cards.
Yeah.
So
that's so helpful. I know this is an interview for like other things, but like you just telling me like, oh, I know about this thing.
Yeah.
Like, that's why I think we need like programs that like help students who are low income, especially students who are intersectionally like low income and queer and like who might be
first generation.
Mm-hmm. Like you're able to tell me like these things because we have this opportunity of like I'm in this interview with you. Mm-hmm. But other people, they don't get invited to do an interview to talk about their problems, and then someone goes, oh, you're having that problem? Let me help you with that. Like, if we had like a thing where that was an event that was like, hey, people who have this problem, come here, it would be a lot better. It would make a lot of people's lives a lot easier.
Yeah, it's hard because you end up navigating a lot of the stuff on your own, and if you don't have the support, if you're not in touch with your parents, or even if you were in touch with your parents, maybe they wouldn't be that helpful anyway because they didn't go to college, But if you're a first generation student, it's hard to figure. There's a lot you're dealing with, so it's hard to figure everything out at all times. Before talking more about CRC. Actually, no. Let's go to talking about CRC. Okay, so you said that so in high school when you were out and you told all your teachers and you told people and people knew that you were out as trans, as queer. Did you find support from the faculty, from the staff at all?
I think for the most part, faculty was supportive of my transition, even if they had like biases about it, because socially in general here in the United States, we're leaning more towards like you're expected to act a certain way whenever someone comes out as transgender or as queer. So like I had trouble with a couple of teachers who just would like be very biased towards me, but it was never so intense that it like overcame all of the other teachers that were just generally like, yeah, whatever. Like I feel like most of the teachers are just like, I don't care enough to make an argument about this because I'm busy dealing with a bunch of other students that are having like who are causing a ruckus. Because like especially because I was in kind of like a I was in a school that had a lot of like children who were like in minority groups, even if they were like middle class, like upper middle class. They would still like a lot of students were like would have like ADHD and like would be like marginalized in other ways. So like they had bigger fish to fry basically. So whenever I told teachers like, "Hey, I'm trans," they would be like, "Whatever." Even if I have like a bias about this, I don't care enough to be upset at you.
Did you have experiences with being misgendered in high school?
Yeah. I mainly was misgendered by other students in high school, or I was just misgendered not in bad faith. Like I think a lot of people think that like as soon as you misgender someone, they think that you're being mean and evil to them. But I think a lot of the times it's obvious whenever someone is misgendering me and they're just like, oh, fuck, I messed up, I'm sorry. Like, those two things are very different whenever it's malicious versus whenever someone's like, ah, oh, man, it's hard for me to understand. Like, you know, like, I experienced getting misgendered a lot, but most of the time it wasn't super big of an effect on me because, like, it was most of the time not malicious.
So why do you think it's important for people to get your pronouns right, to not misgender you?
I think it's important to me for people not to misgender me because my gender presentation is very overtly masculine. And whenever I don't feel seen in that way, I feel like I'm doing something wrong. Like I'm not, like I feel like I'm not doing I feel like I'm not doing masculinity right. So like I need to feel affirmed by other people, and like that's something that I've tried to like unlearn through the years of like I don't need other people to affirm me in order for me to feel correct and right with myself. But like it still goes a long way. Like it still feels good. Like it still makes me feel like correct in my body. It's just like it feels like someone's calling me the wrong name. You know, it's like not even like whenever someone like calls me like my old name, but like whenever someone misgenders me, it feels like someone mixed me up with another person.
So how do you think people could go about learning how to use pronouns correctly?
I think whenever someone asks you to change the pronouns that you use for them, you need to put that at the forefront of your brain, even whenever you're thinking about the person, which I feel like is a big ask. But like, you can't just dedicate like, okay, and this time and situation in this place, I'm gonna call you the right pronouns. You have to do it all the time, no matter who you're around. If the person is out, like to everyone, you have to like whenever you're thinking about the person in your head, like if someone's like, oh yeah, my friend Spencer, he was doing this thing earlier and like it kind of upset me. I need to talk to him about that later. You know, like you have to practice that in your brain, not just with your voice. And you have to practice that around other people. And you have to, I think a lot of the times, be willing to correct other people. Because whenever you don't correct other people for misgendering someone who's out, it can get you into the habit of starting to just go along with it and call someone whatever the other person is calling them.
And how do you think people should respond when they realize that they have misgendered somebody?
I think a lot of people overcompensate whenever they misgender someone and they make it a really big deal. And they're like, she, I mean, he, I mean, they, I mean, I'm so sorry, and this is really hard. And like, that is the opposite of helpful because it just starts making the transgender person feel like, oh man, I'm such a burden to you and I'm bothering you so much with asking you to make this change for me. And I think it's better to just leave it as like, he, I'm sorry. And then move on. Or maybe don't even apologize. Just go like, he was talking about this thing. You know, it goes a lot farther whenever you are just like treating it like a normal thing. Because all we want is just be treated like a normal occurrence. Like this is just a thing that happens sometimes. It's not a big deal. Like I misgender people who aren't transgender often. I misgender animals sometimes. Sometimes I'll walk up to a dog and be like, oh, she's really cute. And they go like, yeah, his name is Buttercup. And I'm like, aw, he's a sweet dog. You know, like it's just like that. You just need to approach that with people and like don't immediately assume that a transgender person is going to be like angry and is going to attack you. Like, even if you've had that experience in the past, you shouldn't conglomerate all transgender people as like people who are going to immediately get pissed at you. You know, like most of us are very reasonable, and we're not going to, especially for adults. Children, I can't say the same, but a lot of adult trans people are just like, it's not a big deal. You correct yourself, it's fine. You just move on.
You said you started community college about 1.5 years ago. How have you liked it so far?
I think I started community college summer of last year, so I think it was more like a year ago.
Oh, a year ago.
So far, I enjoy community college, mostly because it's something that I've never been able to do before, and here in California, I have a lot of it like covered, like the California College Promise Grant, for example, helps cover a lot of my fees. Financial aid covers a lot of my fees. I'm able to get like a bookstore voucher because I'm in the TRIO program. So I think I really like it because it's accessible so far, and I also really like it because in high school you don't have a lot of control, and in college you have a lot more control over like classes, over teachers, and like over how you're treated, and like you get treated like an adult and like with more respect. So I think I like all of those things about community college a lot.
Why did you think you wouldn't end up going to college?
I thought that I wouldn't end up going to college because of my disability primarily. Disabilities, I should say. I was under the impression that basically I would be so debilitated for my whole life and I would never really be accommodated, that it just wouldn't be an option because I would end up failing all my classes because I would have to just not go so often. Because around whenever I was finishing high school, I actually had to like do makeup days by like going to the school on the weekends, and like I was making up like missed time in order for me to even graduate, where I just basically sat in a room and they were like, if you spend 2 hours in this room, it counts as making up a day that you've been absent. And if I wasn't able to do things like that, I wouldn't have been able to pass my classes in high school, because I just had so many absences. Like I did all the work that I tried to, but attendance is a really big part of class, both in high school and in college. And I didn't really understand online education, and I didn't really have a lot of opportunities for online education. I thought it would be a lot more expensive than it is. So I just kind of always thought, like, that's not ever going to be something for me. And I also was determined to not be able to do gainful employment, and I thought that that would be permanently the case forever. So I figured, why go to college if I'm not going to be able to have a career for the rest of my life because of my disability being so debilitating?
So you're taking classes mainly online?
Mm-hmm.
Why is that?
I'm taking online classes because it's really hard for me to like commute due to the fact that I don't drive. So getting to CRC campus takes like an hour. And I guess I could take classes that are closer by, but like I have to commute, which for most things takes at least like half an hour if I'm taking the bus. Anywhere, like from West Sac to Sacramento, it's usually at least half an hour, which is a long time whenever you're, you know, pushing a walker around and you're on all those bumpy streets. And then also another thing is just like being in an unfamiliar place for a long period of time is very difficult for me as a disabled person. Like I need immediate access to a bathroom a lot of the time, and I need to like be able to get up suddenly and go take care of my body in ways that like I think a professor is not really going to understand. Like, why are you just getting up in the middle of my class? And like they might think I'm being disruptive, or I might not be able to be accommodated in the way that I need. So it's just a lot easier for me to do class online.
Do you ever feel like there's something you're missing out on by not taking classes in person?
I think the main thing that I miss out on by not taking classes in person is like community and meeting other students and making friends. Because like I talk with other students and I work on like group projects in my online classes, and like we make group chats and stuff, but it's not so personal. And it just, once it's over, it's over. You don't really make connections with those people.
Do you think you might start taking in-person classes at some point?
I am working on getting my driver's license and hopefully buying a car after that point. And I think once I'm able to use a private car to get myself around, where I can like have a shorter commute for one, and two, like if I'm really not feeling well because of my disability, I can just pull over. I think those two things will make it a lot easier for me to take in-person classes. So I think I will eventually. I just don't know how long it's going to take for me to reach that point because of my income status.
Do you think you might, how long do you think it'll take you to transfer from CRC to graduate and transfer?
I think it's going to take me a lot longer than other people because I think I'm taking like maximum 2 to 4 classes at a time because I can't manage a lot more than that without like being completely overwhelmed because like I have to manage my mental and physical health on top of those things. So I have a lot of obligations with like doctors and stuff like that. So it's a lot harder for me to like I can't take on a full-time studying course load compared to other students. And so I think it'll probably take me like 5 years or more just to get an associate's degree.
So how have you been doing in your classes so far? Have you been doing well?
I've been doing really well in the classes that I haven't dropped. And I think that's because I push myself really hard and like I'm only able to push myself because I am taking so little classes at a time. Like this last semester I only took 1 class because I ended up having to drop the others because they just didn't work out for me. But like that also makes things a lot slower, and that also means I think that I'm going to run out of financial aid sooner than other people do. So it's like a you win some, you lose some situation.
So when you drop classes, why do you drop them?
I think I've dropped only 4 classes so far. I dropped 2 classes at one time. I dropped basically all my classes in the semester, which was 2 classes this past fall, because I got COVID, and it was so bad and I was so sick that I was like, I can't do anything in class right now. And it was early enough in the semester that I felt comfortable withdrawing. And then the next class that I dropped was a art class because it was in person. And it was the only art class that was open. And I was like, oh, I need to take Art 300, so I might as well do it this semester, and I'll do it in person. And then whenever it started getting closer to that date, my health deteriorated. Like I was doing really well when I signed up for the class, and I was not doing so well, so I had to drop the class because I just was not able to make that kind of commute. And then the last class that I dropped was just because I was unclear on like the professor and how they like navigated the class. I think it was one of those courses that's like basically at your own pace, but it was not indicated as such anywhere on the course materials, like course description or anything like that. So I sent my teacher like a lot of emails, and I was like, hey, I'm really confused, what's going on? Hey, you forgot to open this thing on the course. And he was just really disorganized. So I dropped the class because I felt like I needed a lot more structure than that.
Okay, so can you talk some about your experiences taking courses that either wholly or in part focus on queer or trans topics?
Yeah, the main courses that I've taken that have focused on queer topics at all was actually 2 English classes that I've taken. I took English 300 because it's required, and then I took English 301 as like, I guess I will just take this one because I really like the other English class and I need certain requirements for my degree, so I just decided to take that class. And both of them featured readings that at the very least discussed identities that I had intersections with, like being queer and being disabled and stuff like that, even if there wasn't really a focus on it. And for example, in my English classes, both of my teachers in those classes would list their pronouns, and if they identified as disabled or queer, a lot of the time they would announce that. But as for the math class that I took, no one really discussed their pronouns or anything like that. And I think it might be due to kind of the subject matter and like how English is a little bit more politicized than like a math class. But I think it would be really nice to see more classes that are related to STEM subjects like math and science and stuff like that. I think it would be really nice to see them more like talk about queerness and disability and stuff like that in like classes that don't necessarily have to do with it. Like at the very least, like having teachers like discuss their pronouns and that kind of thing.
Yeah, how do you think math and STEM classes, or I guess STEM is math is part of STEM, how do you think STEM classes can professors can do a better job in general for their queer and trans students?
I think we shouldn't assume that students don't need like special care or accommodations for being queer in certain classrooms. Like I feel like there's this like idea that like, oh, we're just doing math, so like political stuff and things like that is not going to come up, so I don't have to worry about it. But like I definitely have had people like in my math class, for example, like we would like study together and get on video calls, and like I had people be like very like, you sound like a woman. Like this was before my voice started dropping. They'd be like, you sound like a woman. I'm really confused, and like making like comments like that, or like seeing my profile photo and then seeing my name and being confused. And like if that was something that we talked about more in spaces that weren't like about like art and identity, I think it would just make life a lot easier for people who are trans and queer to feel like integrated into like those classes.
So in those 2 English classes, you said they covered some queer topics. Can you elaborate?
Yes. I can't entirely remember in my first English class what we talked about that was specifically queer, but I do remember that we introduced ourselves like with our pronouns and stuff like that, which I think was really nice. And then in my second English class, she themed her course materials around our identities, whether that be our race or languages that we speak or our class background and that kind of thing. And she had a lot of readings because it was a no textbook course, so all the readings were like free online. A lot of the readings were written from people who were either implicitly or explicitly queer. Like a lot of the readings were about queerness, but they were by people who were queer, and you could see that in the way that they presented their work.
Did the professor know? Or was the professor queer himself?
I'm not sure if my English 301 professor is queer. And I don't really think it's my business, but I think that she did a really good job of including queer topics into her like course materials.
I just asked because I'm curious to have a better sense of non-queer faculty, how they are sort of addressing, queerness in the classroom or not addressing it. And yeah, not that you have to be queer to assign queer authors or to talk about pronouns, But I do think there's just a tendency, I think, for folks in the queer community to be a little bit more conscious or conscientious when approaching their curriculum.
I think regardless of the fact that of whether my teacher was queer or not, I think because she is a woman, she put gender roles into her work a lot. And I think that since I view that through a queer lens, I was able to like see myself in those works. But if she hadn't included stuff about gender roles, I think she still would have included things that were at the very least mentioned like, hey, trans people have problems, because a lot of it was about like how our identities affect us.
So do you find that it's important for you to feel welcome and included, for your professor to be proactive and sort of, in their pedagogy and the topics that they cover in their class, to be inclusive of queer and trans experiences?
I think it's very important for queerness to not be an afterthought in a teacher's classroom. So, like, I think even if it's just being proactive by stating your own pronouns, even if you're not asking other students their pronouns, because maybe you're not comfortable asking that kind of question, stating your own would be great. Or being like open about like if someone brings them up or anything like that, like because like everyone's gonna have different comfort levels about that kind of thing. But I think the best way to incorporate trans students into your classroom in a way that makes them feel seen is just to be like, to start the conversation, I guess. Like start the conversation even if you're not like singling someone out, which I mean you probably shouldn't single people out, but like, even if you're not like pointing out like, hey, we have a trans student, or like, hey, I want to talk about trans subjects or queer subjects, just sprinkling it in there a little bit is just nice. Like just mentioning your pronouns offhanded, or like having a work from an author and like including in an author's bio that they might be gay. you know, before you read a work that they've made, even if it has nothing to do with being gay. Does that make sense?
Yeah,
Okay.
definitely does. So have you ever considered taking a course that focuses on queer topics entirely, like Intro to LGBTQ Studies or queer literature?
Yeah, I was interested in taking I think it was Introduction to LGBT Studies. I think you might have been advertising it in the GSA Discord server for Los Rios colleges. And I think I was interested in taking that class. And I'm not sure, I think the issue might have been that it was on campus. Do you remember if that was it?
The one that I taught hybrid on campus, but there's one at CRC that may have been taught online.
Okay. Yeah, I was interested in an LGBT studies course, but the only one that I had heard about was hosted on campus, and I felt like I wouldn't be able to make that kind of commute, so I ended up not signing up for the class. But I'm still very interested in taking an LGBT studies related class. I just have to make sure that I'm able to fund it, because I don't know if it would be covered by like my grants.
The same course is being offered this summer and the fall at ARC totally online.
Cool.
Think I put in. And there's a professor at CRC who also offers the course, sometimes totally online.
Cool.
So you would consider it, but it's, you know, there's only one section of the course offered per semester, so if it's only offered in person, that's inaccessible to you, basically. Yeah.
Also, it's hard for me to remember that things like that exist, because like they're not well like advertised, I guess is the word, because like I guess you don't really advertise classes for college, but like it's not something that people really talk about a lot. And then I hear, oh, I can take a class about being LGBT and like studying like how that affects people and like maybe like queer literature, like that kind of thing. I didn't even know I could do that, especially growing up in Texas, because you don't really have that kind of thing.
How do you find out about the classes that you do take, like in terms of how they like fulfill requirements?
I forget what it's called, but it's like a paper and it says like you need to take one class from this list, basically. And so I'll just go through that list and see what meets the requirements. And like, I don't think any classes about like LGBT or queer studies is on that list. And there's a lot of classes I think that fill those prerequisites and requirements that just aren't on the list, and so I just don't find out about them. And also, like, it's a very confusing list because it's not like it doesn't describe what the class is. It just says like Art H 300, and I'm like, what's Art H mean? Art history. Okay, what's Art history 300? Okay, that's the one's about that, and I have to do that for every class. Like, I have to look up what it means, and I have to like figure out like, is this something I would even be interested in? And it's just very exhausting.
Let's see. So, in terms of campus life, I know you've been taking classes online, but have you ever felt harassed or discriminated against on campus because of your queerness? Or your other identities as well while in college?
Yes, I have had at least one issue of people being really weird around me. It was with the TRIO program, I had students who we were going on a trip. So this wasn't on campus, but this was with like campus faculty and like students. But we were going on a trip, and we were all like, okay, let's all make a bathroom break, and then we're gonna go ahead and go and do our thing. And so I am male, so I used the male restroom, and I was also in my wheelchair, so I basically had to like wait for the stall to open. So I just kind of like parked myself like as much in the corner as I could. And then as I was waiting for people and people were like coming in and out, like I would just kept on getting like double takes, and like people would be like, am I in? And they would like go check if they were in the wrong like bathroom. And like I don't think it was entirely malicious, but after that had happened, students kept on like they would look at me and then they would like talk to each other in hushed tones about like me just sitting in the male bathroom waiting for a stall to open, you know. And I was just like, that felt very isolating. And I was able to talk to one of the faculty members on TRIO, and she wasn't really able to do anything about it because like it was, I guess the word would be like a microaggression. And like it's not like anyone was really meaning to be mean to me or anything. They just were like confused and they're not well educated. So like I think as well as teachers not being well educated and not knowing what to do, I think students also have that issue a lot also. And And the only reason I even talked to a faculty member about it was because I could perceive that she was probably queer. And whenever she approached me, I think she came up to me and she said, "So are we?" What was the word that she used? I think she was like, "So are we like brothers or something like that?" Like she worded it in a way of like, "So like we get each other because we're both queer, like we're both queer." And that just immediately made me feel like seen because she did it in a very covert way where other people wouldn't have noticed. But I was like, yes, absolutely, we are siblings basically. And she was like, yeah, what was the problem that you had? And I was like, yeah, these other students made me feel kind of weird. And like she was like, I'm so sorry that happened. There's not a lot that I can do about it, but like I know that I got your back. And like if you ever experience anything like that, you can come straight to me and be like, hey, can I just hang out with you? I'm not feeling safe. I'm not feeling comfortable. And then we can just like be together. And like if you need me to go with you to the bathroom or something, we can do something like that. And so that just made me feel a lot better, even though, because like I understand that teachers can't always do something about that kind of thing, especially whenever it's just like kind of underhanded. So yeah, I've definitely had issues with it, but I have had it addressed as appropriately as I think can be done.
So why do you think it's important for colleges in the district to provide all gender bathrooms, if you do?
I honestly think that segregating bathrooms in general is just kind of silly. Like, it's just a place to do your business. So I think the importance of that is not only like to make trans people feel like comfortable, but also to normalize the idea of like this is not a big deal. This is just a room where people go. Like, I have to pee. I have to go pee. I'm gonna go pee. I'm gonna go in and I'm gonna go out. Like, I think it's politicized too much, and I think having more bathrooms that don't pertain to a certain gender is really important to like kind of normalize that. And also like regardless of school policy and the fact that they're like, hey, our students can use whatever bathroom they're comfortable with. We're not going to prosecute anyone for using the bathroom they're comfortable with. That doesn't mean that other students aren't going to be weird in private. It also doesn't mean that other faculty members aren't going to be weird about you using a certain bathroom in private. Like, no matter what a policy says or a law says, it doesn't mean that just because it says, oh, you can use whatever bathroom you want. Like, I would rather just use one where I don't have to think about which one I have to go into, if that makes sense. Like, I don't want it to be something that I have to think about, because then it just puts the stress on me and I have to make the decision for myself to be safe, and it's not up to other people to make sure they're not disrespecting me.
So how do you find community and friendship in general, on campus or even off campus?
Off campus, I usually make friends through like groups online. Like, even if I'm looking for like local friends, I will look online and I'll be like, okay, I need to find queer community. So like, for example, I've made a couple of friends. I don't talk to a lot of them a lot, but I've made a couple of friends through the LGBT Center in downtown Sacramento. And they have like a youth group for like teenagers, and then they have a youth group for like young adults. And I really, really like interacting with people there. And then with the TRIO program, there's a lot of students who are queer who I can like chat with and get along with, but I haven't really made friends because I think due to my disability and being like stuck at home a lot, I vibe better with other people who are also online a lot. So whenever I meet people in person, like I'll be like, hey, you seem really nice, and we'll like exchange numbers or something, we'll start talking. But they usually have like more of a like social life that's more like I'm always doing other things. And so like, do you want to go out and do things? And it's like, well, I can't. I'm disabled. I need to stay home today because I don't feel well. And like it exacerbates being able to find community with other queer people. The fact that like I can't be accommodated a lot of the time.
How important is queer community to you for your sense of just well-being, general well-being?
I think if I were not around any other queer people, or if I were around a very small amount of queer people in my life, I think my mental health would be at an all-time low. Because being trans specifically, it's a lot harder to relate to other people and to not feel like they're looking at you like you're weird unless they're also transgender. Because like whenever I try to socialize with other people, like they recognize that I'm trans because like I'm not always passing as male, but I do introduce myself as male. And so like I guess the word is I get clocked really easily. So like it's really important to me to have people around me who are going to respect my gender no matter what I look like. And most of the time that's going to be other trans people and not people who are just like, yeah, I'm accepting, but it's just really hard for me. And like they make it like it's a big burden on them for my identity to be accommodated.
So is there anything you can think of that you think the college should do to make trans and queer students feel more included in general on campus?
I think having more events regarding queerness that are like open to everyone, I think that would be really cool. Like, I think we have a lot of like whenever I get like an advertisement or like a push notification about like something happened with the trio program or something happening with like the Center for Inclusion and Belonging. Most of the time, it has to do with race and class, and a lot of times it doesn't have to do with being queer. And while all of that's really cool, it also is like it's lacking in the queer department and it's lacking in the disability department. So if we had more things where like everyone could come and be like, hey, we're gonna watch a queer movie, for example, and then we're all gonna discuss it. And also there's like some free snacks. I think that would help students build better queer community, and also it would help students who aren't queer be like, okay, I guess I'll go to this thing. It sounds fun. I mean, it's a free movie, and like I'll meet some new people. Like I might not understand them, or like maybe we won't get along super great at first, but like it's like a thing I can go do, and like it's a low stakes way of like helping people become more educated. Like whenever we have like really simple events like that, I think.
Well, what makes you excited about your future?
Um, I think the idea of my long term goal with going to college is being able to get a master's in teaching and going into like teaching children. And I think what excites me the most about that is kids are going to be able to see someone like me and be like, oh, I can be that person. You know, like I think it's really important for children to feel represented by the adults around them. And I think I'm always going to be a person who's out about being queer at the very least. I might not, like, if I start passing as male, I might not always be out as being a transgender male because I feel like that's not as safe as just being out and being like, hey, just to mention, like, I'm bisexual. But, like, or I'm queer or whatever. I don't think I could probably use the word queer around small children because that's what I plan on teaching is, like, 3rd to 5th grade. But, like, I could at least mention those kids like, hey, my partner is the same gender as me, you know? And, like, just having kids being able to, like, see that, I think is just what motivates me the most to keep going to school and, like, having that end goal. Like, regardless of, like, money and all the other things that, like, can come good from going to college, that's, like, the main thing is, like, I want children to be able to look up at me and be like, oh my god, cool.
So you seem like you like learning.
Yes.
So what do you like most about learning?
I think the thing that I love most about learning is you get something entirely new whenever you learn something new. Like, you gain something entirely new. And I think, like, you get, like, a whole new perspective whenever you learn new things. So, like, it can change your life just to, like, learn simple things. Like, I'm trying to think of an example of, like I feel like people's lives can be changed by just learning, and like they can become like better people, or they can make other people around them better people if they like let's say like you're learning like persuasive strategies. You might become a really good public speaker, and then you can change other people's lives, or you can change your own life if you learn like coping strategies for like a problem that you have. So I think what I love most about learning is that it can just like it can produce big changes just by putting knowledge in your brain.
And what do you think your professors could do to inspire you and other students to love learning even more in the classroom?
I think materials in the classroom need to feel like things that students can relate to. Um, because I remember in my English class, my English 301 class, the one that I recently took that I thought was really good about like intersectionality and like bringing up like queerness and like race and stuff like that. Someone mentioned, you know, a lot of these stories that we're reading, I feel like they're about growing up as a woman of color. And that's not something I can relate to at all. And so I just got really bored and I didn't want to apply myself in the class. And I feel like if we had a more broad spectrum of like kind of identities that we are incorporating into our classwork, it'll make students more like interested. Like, huh, I actually think this is interesting, and I'm not just in the classroom to just get a good grade and then get my degree. I'm in here to like enjoy myself and learn.
One question I forgot to ask is, do you access any services on campus? I know you're in the TRIO program, but do you access like anything to help with your basic needs, to cover your basic needs, like food pantries, that sort of thing?
Yes, I use the food pantry at CRC whenever I can. I right now rely on my case manager to be able to drive me to campus because it can be so hard for me to commute and then also carry like big bags of food with my disability. So whenever she's able to drive me, I'm able to go on campus and go to food pantry. And I also was having a lot of issues with my financial aid last semester or the semester before, and I was able to get the emergency grant that's like $1,000. You can only get one time, but it's like emergency money that's like, hey, you need money right now. And that was very, very helpful for me. So those two things have been really great. And then also with the TRIO program, if you meet certain requirements and you do certain things, they'll give you like a bookstore voucher and that kind of thing. So that helps cover like, I haven't had to buy any textbooks because I've been taking no textbook classes, but I can get things like notebooks to like write notes for my classes and that kind of thing without any cost to me because I'm getting a gift card, for example.
Are you intentionally taking no textbook classes or zero textbook classes, whatever they're called?
Yeah, I think they're called zero textbook cost classes, and I'm intentionally trying to take those classes because it's just easier on me financially whenever the course materials are free.
Okay, one last question. Anything else you would like to add or questions you'd like to return to? Anything else at all?
I don't know if this is even relevant, but I remembered that the program that I was in middle school that helped with some of my basic needs and like helping me feel like a sense of belonging with other low income students, it was called Communities in School, or CIS. And I don't know if that's a nationwide program or if it was something local or like something that's just like in Texas, but maybe seeing if we can do more things like that, like in college campuses and in high school campuses, especially like helping high school students transition into college. I think that kind of thing would be great. So like things like that I think are really cool. And I just wanted to mention what that's called in case you want to look at it or in case like it is relevant at all.
Was there anything in particular that program did that you'd like to see replicated?
That program helped supply me with like basic needs whenever I needed it, like toiletries and stuff like that, like things that aren't food, because food pantries are very popular, but things that aren't food, like sometimes I'd be able to like go through like they'd have like a big bucket of clothes and I'd be able to pick stuff out that fit me, or they'd be able to like give me like cards to buy certain things for school, like they would give my parents like cards to get stuff, and so it's just like having that kind of funding to help students with things that aren't like that money can get, that food stamps can't get. Like if you need things that like you can't get at a food pantry and you can't get it at like with like a EBT card. So like that kind of stuff.